Yeah, I was just saying. Yeah, that might, like, I don't know how to put stipulations on people and not allow. I mean, but if we could do something, because it would make sense that if the parents were vaccinated, it would give the children some protection, because, like, you don't know where the parents are, you don't know what they're bringing home. But just for the sake to protect their own kids, they should want to be vaccinated. So then, you don't get an incident where they come to school and they test positive in school. Looks like they didn't get it from being in school. I mean, like, there's a chance that they didn't get it from being in school, but it could have been brought home. So if the house is safeguarded, maybe the children can be safeguarded. Henceforth, the school is safeguarded. But I understand it's a little,
yeah,
like, you can't, like, well, if your parents aren't vaccinated, you can't be involved with the program. Which I mean, it is tricky water. It is.
Well, I guess we can get started, Dr. Lee, and if anybody else comes on, I'll add them in just so for the sake of time. So like I was saying, my name is Alyssa. I'm the health and safety supervisor for Head Start and Pre-K Counts. Thank you guys all for joining. I want to introduce Dr. Lee, who is from the Norristown Regional Health Center. She's the Associate Medical Director. Dr. Lee, if you want to say anything about yourself for them.
Yes, hi. So it is an honor to be here, and I'm so glad you guys have joined us today. My name is Dr. Lee. I am the Associate Medical
You're breaking up a little bit.
Tell me if this is a little bit better.
That is better.
Okay. So I am the Associate Medical Director at Norristown Regional Health Center, and I am also a family nurse practitioner. So I take care of patients of all ages. And I've been a nurse practitioner for about 5 years. Before that, I had over 20 years experience as a labor and delivery nurse, and about 10 years as a lactation specialist. So I have been taking care of children and families for most of my adult life. So I am honored to be here today to talk to you more about COVID vaccines in children and to answer any questions that you might have.
Thank you. I really appreciate you joining us, Dr. Lee. So we do have a list of questions already. I'm going to have everybody muted just for the sake of background noise. We are recording this. It will be sent out to everyone afterwards. And you guys all can have an opportunity to ask questions as well. If we don't already address them from the list we have, you can put the questions in the chat box, or at the end, you can unmute yourself and ask any kind of question you have to Dr. Lee. So if you are ready, Dr. Lee, I am ready when you are.
Yes. So I'm just going to start with a quick summary, and then we have a list of questions to go through just to provide some more detailed information about the COVID vaccine. And then after that, if each of you have questions, you can feel free to ask me. Right now, it looks like the group is small, so we could probably just have you unmute at that time. If the group gets longer as the session goes forward, we might have you put your questions in chat. So I'm just going to start off by basically saying it is universally recommended by every healthcare organization and medical professional organization that anyone over the age of 5 receive a COVID vaccine. There are very few instances where there would be an indication to not receive the vaccine. By and large, most people are a candidate to receive the vaccine. We are recommending it for children over the age of 5. Specifically today, we're talking about children between the ages of 5 and 11. The Pfizer vaccine has been given emergency authorization use by the FDA to be administered to children between the ages of 5 and 11. It is a 2-dose series that is given 3 weeks apart. There are many locations in this area where COVID vaccines can be given. Specifically, like I said, I work at Norristown Regional Health Center. And we are administering COVID vaccines to children who do not have to be an existing patient of ours for us to administer that vaccine. The Montgomery County Health Department is administering the vaccines. There are other pediatric locations that are administering the COVID vaccine. And there have been plenty of other organizations that have developed COVID vaccine clinics that are administering to children. I know in the area, Lacan's Pharmacy has been giving vaccines to children. Many of my patients have received their vaccines in school. There have been days that have been designated for that. So the availability is there for any child over the age of 5 in Montgomery County to receive a COVID vaccine. So having said that, Alyssa, do you want to go through the questions that you developed one by one, and hopefully it'll answer any questions that any of you have here today about the vaccine?
Yeah, sure.
Okay.
So starting off, we have, if you can just talk a little bit about the years of research that have gone into developing this vaccine, and also along with that, how safe the vaccine is for children.
Absolutely. So the type of vaccine that the COVID vaccine is mRNA or messenger RNA. And even though this type of vaccine is newly available, it has been under research for decades, probably about 30 years. This type of vaccine was being researched even before the flu vaccine was being researched. And it is a very safe form of vaccine. It triggers the body when you get the vaccine to develop an immune response so that when you're exposed to the virus, your body can effectively fight it. The studies involving children included thousands of children. And through the studies and in real world, since we've been administering vaccines to children ages 5 to 11, we know that it's safe. We know that it is effective. There are very few side effects with the vaccine in most children. Commonly, children will have a sore arm, some redness, some swelling where the vaccine is given. There are children who also have other side effects as well, like headache, body aches, low-grade fever, and those symptoms can be treated with ibuprofen, Tylenol, or your typical over-the-counter products. We do not recommend, and this is important, to give aspirin to children after giving vaccines. Many of you, I'm sure, have heard about myocarditis or pericarditis, which is a side effect of the COVID vaccine that we are primarily seeing, 1 in males and 2 in adolescents and young adults, like in their early 20s. To this date, there have been no myocarditis and pericarditis after a COVID vaccine in children ages 5 to 11. Even in the older children and in the young adults, it is still very, very, very rare. And myocarditis and pericarditis can happen with getting COVID infection. It is very easily treated, and the cases that have occurred so far in the older children have been mild, but it has not so far occurred in children ages 5 to 11. Those children are generally experiencing very mild side effects, tolerate it very well, and do well.
So along with the question of side effects, myocarditis was on there. Can you also talk about if there's any concern for fertility issues with the vaccine?
Certainly, there are no concerns for fertility issues with the COVID vaccine. The COVID vaccine does not alter children's DNA in any way. It does not interfere with their hormonal imbalance in any way. It does not affect puberty in any way. And even in adults that have been receiving the COVID vaccine, it has not affected fertility. We do even give the COVID vaccine to pregnant women, breastfeeding women, and the birth rates are not affected. Fertility is not affected.
So you may not know the answer to this yet, but will children 5 to 11 need booster shots?
And I don't know the answer to that. It is not a recommendation. And as many of you know, these recommendations change. And so at some point it might be recommended. It is not a recommendation at this time.
Why are we encouraging children to be vaccinated if they are considered to be the least at risk for being infected with COVID?
That is a very good question. Even though they are the least at risk, children more and more are getting infected, and the hospitalization rate for children with COVID is also increasing, even though it is not as frequent or as much as adults. But more importantly than that, it helps protect your family and it helps protect your community. The gentleman who came on earlier had expressed concern about younger children who can't have vaccines. So if the children who can get vaccinated receive them, it helps protect their younger siblings that cannot get vaccinated. It helps protect their family members that might be frail, elderly, sick, and at risk for COVID complications, and the community at large. And also, as many of you know, and we're going to probably talk about this later on down the line, but the vaccine does not 100% prevent you from getting infected. It prevents serious illness, hospitalization, and death. It is very effective against preventing that. But should you get a breakthrough infection, or if you're not vaccinated and you get infected, that's missed time from school. And then for parents, it's missed time from work. So by vaccinating, you do reduce your risk of infection and also reduce missed days from school and work. So these are all the reasons why we recommend it for the children.
So along the same lines of might not knowing the answer to these questions,
Yeah.
do you believe that the COVID vaccine will be mandated for school?
I don't know what's going to happen in the future. Right now, it is not mandated for schools. Legislation has actually been introduced to prevent it from being mandated. But that legislation is that bill's going to the House of Representatives. So who knows down the line, but right now it is not mandated and it's not being considered for requirement.
When will the vaccine become available for children that are under 5 years old?
And that's another question I don't know. The vaccine is being researched in the younger children under age 5. And there is suspicion that it might be released sometime this year, maybe in the spring, but we'll never really know until those studies move further along.
So, like you were talking before about a breakthrough infection, can people become infected with COVID-19 if vaccinated?
Yes, they can. Especially with the Omicron variant, which has been more contagious than the other variants, we are seeing breakthrough infection. However, I do want to point out individuals who are fully vaccinated, and that could mean 2 doses of Moderna or Pfizer within 6 months, or a 3rd dose after 6 months. It could mean 1 dose of Johnson & Johnson with a booster 2 months later for those who are 12 and over. Those individuals who are fully vaccinated still have 75% protection against COVID infection, even though breakthrough infections can still occur. When breakthrough infections occur, you are more likely to have milder side effects and to not have serious illness. I do want to point that out. When we look at all the people who are in the hospital, they are by and large not vaccinated. So we do know that the vaccine prevents serious illness and hospitalization and death.
Yeah, you know, I can speak from my own experience. In 2020, my little daughter had COVID, and over-the-counter medicine, she was better. I had COVID. My mom had COVID. So even if you're vaccinated, you get less chance of it being severity. But, in the case that I experienced, she got sick, over-the-counter medicine, and she overcame it. So did myself. The doctors didn't do anything. She didn't go to the hospital or the emergency room. Just like you said, over-the-counter medicine, ibuprofen, Tylenol, alternating it back and forth. And her immune system fought it off by herself.
Great. Great. I'm so glad to hear that.
So if a child has already had COVID, why should they be vaccinated?
So individuals who've already had COVID but don't get vaccinated afterwards are more than 2 times likely to get a repeat infection. We don't know how long immunity from natural infection lasts because it depends on how mild or severe your symptoms were. And so you can have varying levels of protection against repeat infection if you get the illness, but you have a much greater protection with the vaccine, even after having the illness, which is why we recommend it.
Are there any risks involved for children with health issues, immune disorders with getting the vaccine?
There is not. We do strongly recommend, especially children who are immunocompromised and have certain respiratory diseases, heart diseases, autoimmune diseases. It is recommended that they get the vaccine because they have the highest risk of having complications from COVID if they get infected. I do want to point out when we were talking about getting vaccinated after having COVID, there would be a few individuals that we would encourage to wait. And those are the individuals who had really severe cases of COVID, who might have had monoclonal antibodies or like multi-system complications from their COVID. We would recommend that they wait to get a vaccine after having COVID. But aside from that, and of course those cases are rare. So aside from that, and people who might have severe allergies from components of the vaccine, or who had a dose of the COVID vaccine and had a serious allergic reaction, those are like the few rare cases where we would maybe not recommend it, or to recommend waiting. Otherwise than that, if you have health problems, we would encourage you to get the vaccine. And of course, we would encourage you to talk to your primary care physician or whoever your healthcare provider is, about that, so that you could feel more comfortable.
So you had touched briefly on Omicron a couple minutes ago. Can you talk a little about how the Omicron variant is different from previous variants?
Yes. So the Omicron variant seems to be more contagious. It is definitely highly transmissible. It is more likely to cause like a repeat infection in people who've had COVID before. Having said that, even though it can be serious and people are still having complications, we're not seeing as many cases of serious COVID with the Omicron variant. But it is still it is still serious. It still does lead to hospitalization. It has unfortunately still led to death. But the major thing about Omicron, it is very, very, very contagious.
I also had a question submitted about the shedding process from children who are receiving the vaccine, and should they stay home during that time to protect the other children who are not vaccinated? So maybe can you explain the shedding process a little, because I actually am not entirely aware of what that means either.
Right. So no. So what I want to point out is the COVID vaccine does not cause the COVID virus. It does not create any virus in the body. Therefore, you are not contagious after receiving the COVID vaccine. What the vaccine does is it stimulates your own body to create an immune response if you're exposed to COVID. But it does not contain, the vaccine does not contain any virus. It doesn't contain live virus. It doesn't contain weakened virus, and it does not create any virus in the body. So there's no need to quarantine. There's no need to stay home. There's no need to isolate after getting the vaccine.
Can you talk about what the current CDC guidelines for vaccination and quarantine are? I know they're changing almost every day, it feels like.
Yeah, so I can tell you what the recommendations are today. So as far as vaccination, I think we touched on this. It is recommended that individuals over the age of 5 receive a COVID vaccine. And only Pfizer is approved for individuals between ages 5 and 17. As far as quarantining, if you are fully vaccinated, which of course can mean different things depending on which vaccine you have and how old you are. But if you are fully vaccinated, if you've received the number of vaccines that is recommended for you, and you are in contact with someone who has COVID, you do not have to quarantine. But it is recommended that you get a test after day 5, just to be sure. And then if you've had COVID within the past 3 months and then become exposed to someone who has COVID, it is not recommended that you quarantine. However, if you are not vaccinated at all, or if you have not received all the doses of vaccine that is recommended for you, and you become exposed to COVID, it is recommended that you quarantine for 5 days and then get a test after 5 days. And then if your test is negative, that you can end your quarantine, but that you wear a mask when you're around other individuals in public places, if you're indoors, if you are with people who are not vaccinated or who are immune compromised or who are at risk of getting COVID. So it can be a little tricky. It could be a little complicated and difficult to memorize. So my best advice is call your healthcare provider. If you are exposed to COVID and you are not fully vaccinated, let your healthcare provider explain to you. If you are fully vaccinated and you just want to be sure, contact your healthcare provider because they can explain it to you in that moment at that time what the best thing is to do. And the recommendations might change tomorrow. And so it's just always best to contact your healthcare provider.
So what kind of masks are recommended for children? I know for adults right now with the Omicron variant, the cloth masks just aren't really cutting it. And they've been recommending N95s, KN95s. Are those recommended for children? Are the disposable masks acceptable for children?
The disposable masks are acceptable for children and the surgical masks are the best. If you're going to use a cloth mask, it should be like a multi-layered cloth mask. And we're even recommending double masking. So if you're going to wear a cloth mask, to maybe also use a surgical mask with it. The most important thing about masks, especially for children, it's for everyone, but especially for children, is that it fits well, that it stays in place, that it's snug, and that the child is comfortable with it. Because if the child's not comfortable with the way the mask is fitting, they're going to take it off. And if they're not comfortable with the way that it feels, they're going to take it off, they're going to move it up and down. So the two most important things are fit and comfort for children. Now, as far as the N95s, they do make N95s in smaller sizes for children, but the N95s were never really tested or studied in children because primarily they were made for adults to use in the workplace. So you have to use your judgment with that. And it probably depends on the age and the size of your child. You know, if you have a child that, let's say, is a preteen, they're over 100 pounds, the N95 might fit them well. And because they're old enough to understand, they'll wear it the way it's supposed to be worn. But a surgical mask is okay for children between 5 and 11.
That is great to know. I actually do the ordering for any kids in our program that might need masks, and I always order those disposable ones.
Yeah.
It's great to know that those are still acceptable for
They're
them.
still acceptable, yeah.
Well, I could say, like there are N95 masks. I have them for my daughter, but those disposable masks you have at the school to pass out. One time my daughter's had broke and she wore one of the masks that you all hand out. Now, after you wear those masks for, if a kid has them on all day, the fibers from their breath, breathing in and out. My daughter she had upper respiratory infection. So you might want to switch those disposable masks to something different, because I know from her wearing that for that short period of time, she got an upper respiratory infection. She was out of school for 10 days.
Oh, wow.
So you might want to not get those disposable ones and get something better.
No, the disposable masks are effective, but you do bring up a good point, especially with children. If they're wet, or they're soiled, they need to be changed. And depending on the age of the child, if they're drooling, if there's just a lot of saliva, if their nose is running, and it gets wet, then yes, absolutely change it, because it doesn't work as well if it's wet, and it's more likely to get wet with a child than it is with an adult.
And that happens a lot with our kids. Their nose is running. There are some classrooms, they go through masks like one every 5 minutes, it seems like. Along with masks, about testing. So which tests are more accurate, rapid / at-home tests or the PCR tests?
The PCR tests are definitely more accurate. We do know that the home test, the rapid test, the antigen test, these are all different names that you might hear. They are not as sensitive. They are not as good as at detecting Omicron. So we do recommend a PCR. However, they're still good. So if that's what you have, then you should definitely use it. There has been a time where many of you may know getting a test was difficult. All of the testing sites were filled to capacity. There was a long wait for testing. So in that case, it is better to do the home test. It is recommended, if you're going to use the home test, to wait several days after having symptoms. That is when it is more likely to pick up an infection. We also recommend that if you have symptoms and you do a home test or a rapid test, whatever you want to call it, and it's negative, to repeat the test again in 2 to 3 days, because we do know that those home tests are not as effective in picking up the Omicron variant. So they are valuable. They're just not as good as the PCR, the typical send out test.
I think it's important too to note that if you are waiting for a test result, that you should stay home.
Absolutely. If you have symptoms and you're waiting for a test result, you should be home. You should not be at school. You should not be at work. And again, consult your doctor, as far as advice, but you should be home if you're symptomatic. And let's face it, COVID is not the only illness that's around. We still have flu, we still have common cold. Those things are contagious too. And so you don't want to spread those to other individuals either.
We've kind of forgotten about other illnesses.
They're still there.
Now, with the home test, like, you should really warn parents about, the solution that comes in a little tube, but some of the home tests is very, very poisonous. Like, little kids should not be around those tests. Like, the little vial that comes with solution, it's very poisonous. Like, you shouldn't pour it down the drain. You cap it up and put it in a dress, because if it comes in contact with water, it creates a gas that's really harmful and poisonous. So if you let parents know that, like, that stuff is deadly, the stuff that's in the test.
Yeah, I don't know about it being fatal, but nevertheless, you should always keep your children away from chemicals. If it's not food, they shouldn't be able to reach it easily. You don't want them to put it in their mouth because it can create illness for sure.
Yeah, I read up on it. It's deadly. It's a deadly chemical that's in those little vials. Like, it can kill you.
So,
thank you for pointing that out.
So, Dr. Lee, what would you say to parents who are hesitant about getting their children vaccinated?
I would say talk to your healthcare provider, ask the questions, talk about what concerns you. There's so much information out there, and not all the information that's out there is accurate. If you want accurate information and you're looking on your own, the best place to go is the CDC's website. And it's very easy to read. Um, it's um, it's said in a way that's easy to understand. The Montgomery County Health Department has information that's available. So you could go to their website and look for information. Many of your healthcare providers, our healthcare site has information on our website. And most of the major health systems has COVID information and COVID vaccine information on their website. So those are websites that are trustworthy. But a lot of information that's on YouTube, that's on social media, that comes from just various other non-healthcare sites may not be accurate. So if you have a question, if you have a concern, talk to your healthcare provider about it. But it is definitely recommended. The vaccine saves lives. It is the best protection that we have right now. Between vaccines and masking, those are the two things that we have. But the vaccine is the best thing that we have to prevent serious illness, hospitalization, and death. And we know that from the many, many hundreds of millions of people in this country alone that have received the COVID vaccine. Hundreds of thousands of children have already received the COVID vaccine. So we know that it's safe and we know that it works.
So that was about, my last question was about where to find accurate information in Montgomery County. But I think it's just good to emphasize that everything you see online is not accurate. And there was so much misinformation handed out at the beginning of the pandemic that, what you see on Facebook is not always true. So it's good to have accurate resources to find the answers that you need.
For sure.
So there was a question here in the chat box. Anna asked, how long do negative symptoms after vaccination last?
That's a good question. Up to several days. We find that most children have side effects for a day, but if they have headache, body aches, that could last up to a few days.
Does anyone else have any questions? This is now your time to ask anything you want to know from Dr. Lee about COVID. You can take yourself off mute. You can put the question in the chat.
Hi, I have a question, please.
Hi, go ahead.
So after somebody tests positive for COVID and they quarantine and they do everything they're supposed to, according to CDC guidelines, do they have to go get another test to confirm they're negative at some point, or does that not really matter?
No, and we actually don't recommend it because the test can be very sensitive. The test does not test for the virus itself. It's testing for genetic material of the virus. So once someone has the virus, their body can break that virus up into 1,000 pieces and you're no longer contagious, but that test can pick up just one of those pieces and remain positive. So people have remained positive long after having COVID, sometimes weeks, and in even more rare instances, even months. But the one thing we know about the virus is once you start feeling sick, the amount of virus in your body starts to decline pretty rapidly and is less and less contagious. So really the best recommendation is to quarantine for the 5 days and then the additional 5 days with masking if you have the virus, and not to retest as a measure of whether or not you're still infectious.
Got it. Thank you.
You're welcome.
There is another question here. Anna asked, what is the difference between the Pfizer and Moderna vaccine?
So they are the same type of vaccine. They are both messenger RNA vaccine. The way that they work is the same. Their safety is the same and their effectiveness is the same. It's just two different companies. It's like wearing, Gap versus Banana Republic. You know, the quality is the same, the name is different.
Are there any other questions? No?
One more, I'm sorry.
Okay, go ahead. No,
As
fine.
far as getting together with family members that had COVID, and like I said, it's been the 10 days. It's mainly my mother-in-law. She misses the kids and she just wants to come over. She just had COVID, her and my father-in-law. They're both vaccinated, they're both boosted. It's been about 7 days, I want to say now. But I still see and hear that they still have symptoms, but they're swearing that they tested negative. I mean, what do you say to that?
So that's individual because you said 7 days. And so the general recommendation is 5 days of quarantine and then 5 days of masking when around other people. And so it depends on whether your household is vaccinated as well. So
Yeah, everybody is except the kids. They're under 4.
yeah, so if you have children that are not vaccinated because they're under 4, it might be safer to wait the full 10 days because there's no reason that, you have to be in their company, but
Yep,
that's kind of a discretion that you have to use.
sounds good. Got it. Thank you so much.
Sure.
There's another question here. What is the difference between Johnson & Johnson and the other vaccines?
Right. So the Johnson & Johnson does use slightly different technology than Moderna and Pfizer. It is not the mRNA vaccine, but it is very similar. There is still no live virus or weakened virus in the Johnson & Johnson.
Okay, I have a question. Like, what do you recommend for people who are long haulers? Like, I had COVID in 2020 and sometimes I still get like headaches
Yeah.
or, like muscle aches. Is there anything that they do for people who have like symptoms from, after they got over COVID? Like there are some symptoms that like headaches on the side of the head, like sometimes muscle aches and all that stuff. Is there anything that you recommend for things like that?
So there actually are COVID recovery clinics, and each healthcare system might use like a slightly different name, but most of the major health systems do have something. Jefferson, Temple, University of Penn. So you could reach out to any of them, whichever is most convenient for you, to get some more information about that and whether or not you would qualify for something like that.
Oh, thanks, Don. I really appreciate it.
Sure, you're welcome.
Lily asked, after being positive for COVID, when should we get the vaccine? Is it in 3 months?
So you can get the COVID vaccine after your isolation has ended and as long as your symptoms have improved or gone away. Now, remember, and this is something that would be discussed at the time of getting the COVID vaccine, there are a few individuals who, after having COVID, should wait a little bit longer. If you had more severe COVID illness with severe complications, or you had monoclonal antibodies for treatment, then you may have to wait a little bit longer. But if you had like mild to moderate illness and you didn't require hospitalization or treatment, you just need to wait till your isolation is over and your symptoms are gone. So, for instance, no fever and the rest of your symptoms should be at least improving.
So you don't have to wait the full 3 months, 90 days.
You do not. No. No. Many people choose to because we know that if you get COVID, that the antibodies do last at least 3 months, and the likelihood of getting reinfected with COVID within 3 months is very, very, very rare. So it would be reasonable and you could wait, but you definitely don't have to.
Okay, that's good to know.
Yeah.
anyone else have any questions? What is COVID pneumonia?
So it's a complication of COVID. So whenever you get a virus, whether it's COVID or the flu, and for some people, even the common cold, you can get secondary complications. And so that is one of the complications of COVID, that they get a pneumonia, and they call it COVID pneumonia because the way that it looks on an X-ray is very specific to individuals who've had COVID. But there can be treatment as long as there's no respiratory failure or respiratory distress associated with the pneumonia.
They also talk about the same thing with COVID flu, correct? Are you able to get COVID and flu at the same time?
You can. And it was causing like a little bit of a joke, and there were some memes that were out there. The first case, I believe, was detected in California, and they were calling it flu-rona.
That was the name. I could not remember the name.
Flu-rona. But yes, definitely, you can get two different viruses at the same time. You can have the flu and you can have COVID at the same time. It is flu season. And so, and flu was back last year because we were so strict with, social distancing, isolation, kids not being in school. We didn't really see flu last year. It was rare, but now we're back out. We're out a lot more. We're having a lot more contact. So the flu is back. And yes, you can have flu and COVID at the same time.
Anyone else? All right. Well, thank you, Dr. Lee, for joining us. I appreciate it so much. You have so much knowledge. There's one more question. If a child has flu symptoms now, would you recommend to test him for COVID?
So when you ask the question, he has flu symptoms, I would recommend a test for COVID because there are some symptoms that overlap from the flu and COVID. A fever could be from flu, it could be COVID, it can be from, various illnesses. The cough, something like loss of taste or smell is very specific, to COVID and not a symptom of a flu. But the general symptoms like fever, headache, body ache, they could be either. So if you're having those symptoms, then we would recommend a COVID test. And, depending on where you're going, you could also get tested for the flu as well. Obviously, if you go to a COVID testing site, then that's all that's going to be available to you. But if you're in, let's say, a healthcare practice or an urgent care setting, then you could potentially be tested for both.
It was also asked, what are the side effects of the Johnson & Johnson vaccine?
The side effects of Johnson & Johnson are similar to Pfizer and Moderna. At the site where you get your injection, having a sore arm, swelling, redness, but then also headache, body aches, mild fever. That's pretty universal for all of the COVID vaccines.
All right. Anybody else? Samia said she got the J&J vaccine. What would you advise for a booster shot?
You can get any of the available vaccines as a booster. I think you'll find it difficult to find Johnson & Johnson. It's not offered in as many locations as Moderna and Pfizer, but you could get any one that's available, and it's recommended that you get your booster 2 months after getting your original vaccine.
And the definition of fully vaccinated has changed now, correct?
Yes, because the recommendations for boosters have been changing. So as those recommendations change, the definition of what fully vaccinated is will also change. So right now, Fully vaccinated means you have your original vaccines and then a booster if it's indicated for you.
All right. Anyone else? Last call. Okay. Thank you everyone for joining. This is being recorded and I will send the video out to everyone. You can refer back to it if you have any questions later that come up. And thank you again, Dr. Lee, for joining us. It is so great that you took the time out of your schedule to do this for us. So thank you, I appreciate it.
It is my pleasure. Thank you for having me. I hope you found it helpful. And in Norristown Regional Health Center, we're available if anyone needs our assistance.
Thank you. Really appreciate it.
Oh, you're
Thank
welcome.
you. Have a good night, everyone. Thank
You do the
you.
same.
night.
Bye-bye.
Thank you. Thank you so much.